The U.S. saw its largest single-day increase of coronavirus cases Wednesday, with more than 50,000 new infections being reported throughout the country. National Institute of Allergy and Infectious Diseases Director Dr. Anthony Fauci issuing a warning to states earlier this week that if the virus isn't controlled, the U.S. could end up reporting more than 100,000 new daily cases. Several states have already began scaling back on their reopening plans in response to spikes in their communities. More than 2.6 million Americans have been infected with the virus since the start of that pandemic, and at least 128,000 deaths have been reported. A growing number of states are announcing a second round of lockdowns. One of the first businesses to get the boot, bars. With no windows and little room to move around, bars often force people to gather closely together, but health experts say there's more to it than that. Fox's Kevin Cork explains why these hot spots are hotbeds for the virus.
As the coronavirus badgers the South and West, bars are largely being blamed for the spike. California, the latest state to order pubs, beer gardens, and other drinking spots to shut down, joining Arizona, Texas, Florida, and dozens of counties. Health experts say there's good reason behind the closures, as it's frankly difficult to be socially distant while socially drinking.
I think the hardest part about bars is that you really aren't going to be in them having a drink or eating food with your mask on, and that's the most critical piece.
The risk factors go well beyond not wearing masks. Alcohol, as you know, lowers inhibitions, meaning people are more likely to talk loudly, breathe heavily, and even stand in close quarters. All behavior that can increase the spread of COVID-19. And if you think people won't go to bars if they feel sick, well, think again. Your drinking buddies easily could be silent carriers and not even realize they have the virus.
They may not even realize they're sick. They might just think they're tired from work or have a headache or allergies even. So that notion, and then going to a bar, it's very easy for that mild symptom or asymptomatic or even pre-symptomatic transmission to occur.
But many bar owners feel they've been unfairly targeted, arguing restaurants, stores, and other businesses are still open and packed.
The whole blaming the bar thing, it's like they think that, okay, closing the bars is going to solve all the problems. It's not.
While several counties have traced clusters of cases back to bars, health officials say it'll still be weeks or possibly even months before we know the real impact of reopening. In Washington, I'm Kevin Cork, Fox News.